Here's the third health fact is subluxations can cause 4 things that start with D, okay? And what they are is discomfort, dysfunction, disease, and degeneration, okay? Most people, they typically get discomfort and degeneration, but they don't really understand disease and dysfunction as well, okay? But remember, function is the most important thing, is the medical definition of health, right? We don't even understand, this is one of the misunderstood things. So when we talk about function, okay? If you think about the heart beating, and the brain is basically telling the heart how hard to beat, how fast to beat, okay? That's our pulse rate and our blood pressure, okay? Depending on what we're doing, we might be needing higher pulse rate, higher blood pressure, or if we're resting, we want lower pulse rate, right? Lower blood pressure, right? But if you're like in the middle of a marathon, you want your pulse to be pretty high. That way you can get the blood to your muscles and back to your lungs to get oxygen and keep that cycle going, right? But the brain is what's coordinating that. The brain is what's telling the heart to beat. And it does so through that spinal cord. And again, 100% nerve flow means optimal function, okay? So it's, again, normal blood pressure, heartbeat. But what happens is when that spine, so here's the thing. When it's like that, it's like you're driving down Spear Boulevard, you got all greens, and the whole flow of traffic can go and go and go.
It's a dream.
And go.
Right.
It's a dream. It's something that doesn't even happen, right? But this is what is supposed to be happening when the roads are functioning properly, right? You're supposed to, it goes green, then the next one goes green, the next one goes green, the next one goes green, and you're able to make it through, as long as no one's speeding, right? You could also think about it like I-25 meets I-70, right? This is more realistic. There's a lot more than just that one road going on. You have trillions of nerves, trillions. And so it looks more like this. It looks and feel more like I-25 meets I-70, okay? It's more complicated than that. Same concept though. When everything's flowing nicely, you can merge on, merge off, merge on, merge off, get to where you need to be, you're on time for work, right? What happens though is someone has a slip or fall, auto accident, and they have subluxation, sprain a joint, irritates the nerve. And what happens is that function or that message from the brain to the heart, it gets interrupted. And so it's not that it goes from 100 to 0, it just has to go from less than 100. So in certain cases, it's just like 70%. So 30% interruption, now the heart can only function at 70% because only 70% of communication from the brain to the heart. And this is what causes dysfunction and disease. So your body's not able to coordinate itself as well as it can with the other areas of the body, okay? And this can cause a whole variety of different things. With the heart, it's really simple to think about. Have you ever seen, so symptoms of this would be like when someone has both of their feet are really, really swollen to the point where you can push into the swelling, pull your hand away, and it's still pitted. Mm-hmm. That means that the blood is sitting at their feet and it's not getting pumped up back to their heart, okay? That's an extreme case, just to like throw it out there. And eventually that could cause disease. So first something works with dis-function, because it's not functioning at ease. So the opposite of this, dis-ease, until eventually it becomes pathological. And the cells have actually changed shape and form and function. And now it's a full-blown disease. So the state before a full-blown disease is dis-ease. The body functioning with disease or dysfunction. And that's kind of how we came to the word disease. So it can lead to things like high blood pressure, low blood pressure, irregular heartbeats. And so this is like trying to get onto I-25, I-70, and it is backed up, rush hour. Right, every morning, right? It's a pain. It takes us 30 minutes longer than it should, right? And this can happen in all different areas. So it can happen to the sinuses, causing allergies, sinusitis, runny noses. Okay, especially when we see the changing of seasons, different pollens start to get out there, and we start breathing in these new pollens, and the body thinks that it's a toxin, and that's why it starts to produce a lot of phlegm, a lot of mucus to prevent that from getting into the body. Okay. Can happen at the lungs. Wheezing, asthma, shortness of breath, stomach, gastritis, acid reflux, GERD, large intestine, constipation, irritable bowel syndrome, colitis, and also the reproductive organs. So you can see menstrual cramps, irregular menstrual cycles, infertility. So you can see the picture that the nervous system controls and coordinates the function of every cell, tissue, and organ in the body, especially those that we don't even really think about, okay? And this isn't something that's new. Hippocrates, he's the father of modern medicine. I have him in the examination room because he said, look well to the spine for the cause of disease. This is in ancient Greece. Ancient Greece, that's before medicine. He's actually the father of medicine. I mean, that's why he's not the father of modern medicine, the father of medicine, right? And then Thomas Edison, he was America's, one of the founding fathers. So the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. Okay. How far have we come? Yeah, we've come pretty far. Can definitely improve on this though. Because medicine is an amazing thing, especially for acute things like we talked about, like when you need to get that stitch, yes. When you have a fracture, yes. When you have like a heart attack, yes. But what we've really failed at is our chronic conditions. And having somebody be reliant on taking a pill every single day to get through their day. Like that is where we fail, honestly. So now to spinal hygiene, okay? When you think about spinal hygiene, think about it very similar to dental hygiene, right? Except the words are different because it's different conditions, different areas of the body. So spinal decay, you can think about it like dental decay. Osteoarthritis, okay? We've heard of osteoarthritis. There's different types of arthritises as well, but osteoarthritis is like 80% of arthritis ends up being osteoarthritis. That's just wear and tear, okay? That one can be very preventable. Bone spurs is where we see these big jagged edges on the front of the bones. It's another word for the same thing. And then degenerative disc disease, that's where that disc gets thinner, less space for the nerves to exit, higher likelihood of a subluxation, different types of pinching nerves. And so my sister's you know this? My sister's a dentist.
I think so.
Yeah, so my sister's she's in orthodontic school right now. So she's gonna be an orthodontist. And so we talk about this different types of stuff, like how do we like talk about patient care and stuff like that. So, so what do you think a dentist does if they find a cavity?
Give you preventative stuff, so how to prevent more.
Yeah, they have to first take care of it, and then they try to do the prevention, right? But first they might have to go and drill and fill and whatever else they have to do. Hopefully they don't have to pull, When should you start treating your dental problems?
Twice a day.
Yeah, you should. Yeah, that's the prevention side of it, right? But once you know you have a problem, you should get it taken care of, right? Because it will only get worse. It will not get better, right? What age did you start to see a dentist?
I was as soon as I got a tooth.
As soon as you got a teeth? Yeah?
That's what I thought they did.
Yeah. As soon as you get your milk teeth. Babies get their first set of teeth in, that's when they should go start getting checked. And how often should you brush or floss?
Twice a day.
Twice a day, right? You'd definitely be brushing, flossing twice a day. And when are you gonna stop caring for your teeth? This is a trick question, I swear. I get, every time I get someone that says that, the truth is,
Never.
yeah, the truth is never. And you know why? If your teeth have fallen out, you probably have something going on. You probably have like gingivitis, and you might have like gum disease. And so your dentist is still gonna be helping you with your oral health. You may go to more of a specialist, but you should still be getting your oral health get checked out, right? And so then it becomes when you stop seeing a dentist. You really should be seeing a dentist throughout your entire life, right? And you may or may not know, many dental problems can actually lead to heart issues, right? Because it goes directly to the bloodstream, right? Everything is connected. And so you can get gingivitis or something like that, You get this bacteria in your gums, gets into the bloodstream, can actually cause different heart conditions. And so that's part of the reason why too. So let's parallel that to spinal hygiene, okay? So what age did you start to see a chiropractor? 26?
I went last year briefly, I was 27.
27?
You said like 24.
24? Wilina?
Rec-wise, I was probably 30-something, but physically seeing a chiropractor all the time, 44.
Yeah. So for me, it was 16 years old, but that's because I got into an injury. I had an injury, right? The average person sees a chiropractor at age 51 and a half. So everyone here that is before that, you are doing better than average. So like seriously, like pat yourself on the back, because that is saying something, right? Especially after everything we talked about. Even if it was just for a time or two, I really do mean that. So do you get regular spinal checkups for subluxation? I get checked every week. Relina will attest to that. If it's not every week, and neither of the doctors, exactly, if neither of the doctors that I get adjusted by and I treat come in, it's every other week. And if I don't, then I'm on the spinal decompression table, or we're doing shockwave therapy. Like I'm working on myself. How often should you be doing some simple things like brushing your teeth for your spine, stretching, and your back and your neck?
Every day.
Yeah, I mean you should be doing it 5-10 minutes. If you can do it twice a day, like excellent. That's excellent. Twice a day is amazing, but at least once a day, if not every other day. If you think about it, that's like brushing your teeth every other day, right? You should be doing it at least once a day, right? And it doesn't take long. It really does not take long, right? I don't know about you guys. I would be like grossed out if I didn't brush my teeth twice a day.
Yeah.
I would be. I like run my tongue across my teeth. I'm like, oh, it's like nasty. I'm sorry. I've got tongue
Why
scraper
you been
and
over here
stuff.
talking
Like,
about it? I have been.
yeah,
so.
right. We're due.
Makes me want to start sitting here and.
Yeah, right. It's the truth though. You start to like notice like I like when it feels good. I like to feel good, and so you should naturally be doing this stuff, and it should be easy because you get into the swing of it and you start feeling good. And you want to feel that way, so it shouldn't be this uphill battle. So when should you start caring for your posture? This is a good one too. When do you think you should start caring about your posture?
I think since you're little, like 5, 6 years
You're
old.
carrying your backpack.
Bingo. Yes. Why would we not start like when kids are in kindergarten at 1st grade? Like we're gonna put these big bags on them, have them go to school, try to have them sit down for like 4, 5, 6 hours a day, and we're not gonna teach them like the right way to do these things, and yet we ask them to do that for the next 12 years of your life or more. Like, doesn't that make sense? Like, shouldn't we be starting off by like just educating them? Like, I don't know. It doesn't have to be that much. It really doesn't have to be. But that's really when I personally think we should. When someone's in like kindergarten, 1st grade, we should start be talking about that type of stuff. Because it's very relevant to them for their whole life.
I would have never thought about that.
Right, most people don't. Most people don't, and that's why we're doing this class, is to talk about that type of stuff. And so when will you stop caring for your spine?
Never.
Yeah, I mean, it's one of those things, it's like,
Guess when I can't walk.
What's your oldest patient? You know?
How old is Cecilia?
93.
Okay.
93
That's
years old.
the oldest one I think of.
93.
Or Madeline,
And Madeline might be up there too. Yep.
42, so, yeah.
1942, so
I think
she's
that's what it was.
82.
Yeah.
93 is my oldest patient. I hope to keep her around for a long, long time. She lives independently.
Oh, well, I was gonna say she drives
Do you want
herself
to?
here.
She drives herself here, lives independently.
Yeah.
She got hurt by gardening.
By what?
Gardening.
Okay.
She was gardening her front garden. And so that's one of the things we're like, hey, it might be time to bring somebody else in to do that. That's hard work for me.
I hate it.
Yeah, I'm going like weeding the front yard. God, my back hurts just thinking about it. Like, come on. And the truth is, like, I've also taken care of paraplegic and quadriplegic patients over at Chandis Center for Health down in Lakewood. even people that you think like these people don't walk, don't do this, don't do that, you would be so surprised at how bad they need treatment. They're sitting down and they're bedridden 99% of their lives.
Scott's the one you amaze me with.
Scott, another patient with MS. Yeah, you can totally tell when he's having a good day too. When he's having a bad day, he's in here in a wheelchair. He's having a good day, he's got his cane, and he'll leave it over here on the mini fridge as he walks over. You can totally tell, night and day. And when he walks out,
Yeah, that's amazing.
it's really one of those
The day
things.
he came in with a wheelchair, and then the next day he walked in here, just amazed me.
Right. That's the stuff that gives me chills. That's the chiropractic miracle that like we don't often talk about it enough and like really say that type of stuff, but like that's the reason why we do what we do, to make him and other people function, because he's still in pain, I guarantee you, right? But just to get him to function that much better, right?
And his mood's different afterwards.
Oh, absolutely. Yeah, people in pain, they're not themselves. They're not themselves. And so when should you stop seeing a chiropractor, right? It doesn't mean that you need to be getting like corrective care all the time. It means just to get your checkup. Go get checked for subluxation throughout your life. Set up a regular routine, whatever your 5,000 mile marker is, just to make sure that I'm good. And when you go on a long trip, or you go do a marathon, or you go do something that you love to do, go get checked before and after. Set myself up for success on the front end, and make sure I'm taken care of afterwards, because I just put all that stress on my body. That's what it means by that, okay? I know myself, my goal is to be hiking 14 years, I'm 80 years old. I'm very serious. Why not? I don't have to be up there in 4.5 hours. I can take all day. I can take all day.
Hey, I swear I seen a gentleman that was 90-something years old that does this hiking 14ers.
Yes, that's why it became a goal of mine, because I saw a woman. I had a friend pass away, and so myself and my other chiropractic friend went on this hike like a couple weeks afterwards, and I saw this woman walking down, and she must have been 80 years old, and that's what kind of hit me, because I'm like, my friend just passed away. Me and my other chiropractic buddy are like doing this thing that he should be here with us, and then I see this old lady. She didn't look old, she didn't act old, but you see gray hair. She's by herself, and she's on her way down as we're on our way up. I'm like, I want that. You know what I mean? My buddy Josh can't do it, so like, why should I not? And it's just got to be what you love to do. But it's just one of those moments you like really realize like how precious life really is. So the other thing is that time does move very fast, right? Time flies. Like I swear I'm now 32. Every year goes by faster and faster, and I know it's just about to it's gonna be lit on fire. Just like it's gonna feel like I'm burning the candle on both sides. I know it. And so this is what your spine, how fast your spine can decay, okay? So this is someone, subluxation, 27 years old. Okay, what we should be seeing out, just for a little reference, is we want to see a backward C-shaped curve, acts as a shock absorber. Nice and thick, full level spaces between the bones like this compared to this. See how that's narrow compared to that? And then squared, rounded edges, okay? And so this person, in just a short, this happens to be 8 years. What do we see? Jagged front edges on the front of the bones. It's getting thinner between the bones. This is osteoarthritis and disc degeneration. It takes about that long, 8 to 12 years, to move from phase 1 to phase 2, from phase 2 to phase 3, from phase 3 to phase 4. So if you think about it, that's 40 years from someone to go from normal to as far gone as you can pretty much go. It can move really quick if you just think about it in like that time frame, because once you go to this, you can't come back here. That's the problem. Once you have these jagged edges on the front of these bones, that's not going away. There's a lot of things that we can do to help someone become pain-free, good quality of life, good range of motion, all of those type of things. But certain things, there's a limit to how far the body can adapt once you get there. Okay, so that's an important key to the puzzle too, is to stay ahead. That's why prevention is so important. And then sometimes people say like, well, isn't it just age related? And the truth is, no, it's not age related. Okay. This is someone age 60, really nice spine here, nice curve. That would be considered normal. And this one's really straightened out. Now, some people will say, well, like, could this be a photo of someone who's younger and not really that age? That's fine. But why do you say, or why do some people have like osteoarthritis in their left knee and then their right knee is fine? If it was age, those knees are the same age. Shouldn't they both be osteoarthritic and degenerated? And the same thing would go for the rest of your spine. Like just because, like these bones that are up here, those are the same age as this bone right here in this joint. It becomes wear and tear and a lack of maintenance. It's like having a house, right? Someone can have a 100-year-old house. It's been maintained throughout generations. Beautiful, great bones. Someone could have a 10-year-old new build, not maintained, first-time home buyer doesn't know what they're doing. They go, and in 10 years, the thing needs so many parts of it replaced, right? I mean, it's how it's maintained, right? And so the same thing with our body, right? That's why you can be 80 years old and be super healthy, or you can be 20 years old, be super sick, right? So, pop quiz. You guys ready? It's gonna be a tough one. Okay, so the human body was designed to do what?
Function.
Heal itself.
And heal. Yeah. Function and heal. I would say yes, because healing is part of functioning, and vice versa. If you're not functioning, you can't heal. But it was designed to heal itself. That's why you're the most important doctor. Okay, we gotta give your body what it needs to heal itself. What that means is Dr. Gonstead, so I practice Gonstead chiropractic, he's right over there. Dr. Gonstead said, it's gonna be paraphrased. He basically said, if you give the body all the nutrition that it needs, you remove any subluxations, any stress from the body, and it can do and heal whatever it needs to do. As long as it does it, as long as it has what it needs, and you can remove that stress, it can do what it needs to do. When it doesn't have the proper nutrition and it has too much stress on it, subluxation, it will not be able to heal itself.
Got it, quit my job.
I wish it were that easy. I do.
Only in our dreams, dear, only in the dreams.
Yeah. Blank causes the 4 Ds: discomfort, dysfunction, disease, and degeneration. Al, you're excused for this question. You stepped out during that.
Spinal, what's it called?
Subluxation.
Yes, subluxation. You're exactly right. It's
I'm proud of
subluxation.
you, Emily, because I think you're the only person that's ever remembered the word.
Yeah.
I'm like trying to merge
I
two
did-
different words
I was
together.
testing you out. Yeah.
I
That's
never
okay.
remember it, so.
That's
You're
okay.
here.
Hey, when I forget, that's when we're in trouble. Okay? So you're all good. You're all good. How are subluxations corrected? We didn't really go over this, but I think that you guys can kind of guess. Put this one together. Good thought. That is one way to prevent it, right? But to correct a subluxation, it takes a chiropractic adjustment. There's only one profession that actually corrects subluxation. Physical therapy, they will work on muscles, tendons, ligaments. Chiropractic will work on joint and nerve. In our office, we're a bit more dynamic and well-rounded than that. We also take in, we do therapeutic exercises, we'll do spinal decompression, shockwave therapy to work on soft tissue injuries as well. But as far as the subluxation goes, the chiropractic adjustment is what corrects that. And who provides the chiropractic adjustment and why? You know that it's a chiropractor, but why do you think that we do that?
To help fix people.
Yeah, our goal is to help you guys function, right? Just like somebody helped me, right? I wasn't able to play football. That was my big thing. I was 16 years old. Football was my life. That was where I went to an all-boys Catholic school. I did not have, I was like going, it was like work. It's like, do I have to go to school? The only thing that I had to look forward to was football with my friends. And that was ripped away from me. And so our goal is to get people to do what they love doing, whatever that might look like. So for Emily, it's gonna look very different than it will look for Monica. And Monica and Al, it might look a little bit more similar, but definitely not 100% the same. Definitely different than Willina, definitely different than me, right? Here's another question. Can subluxations be corrected by medicine? Yeah, there's no, medicine focuses on a lot of things. They're really, like I've said this, they're really great at acute injuries, acute issues. But when you have a subluxation, it's a bone out of place, pinching and irritating the nerve. That's a mechanical issue. Most of medicine will give a pill for an ill. That's a chemical. There's no chemical that can correct a mechanical issue. You have to get in there, you have to move it mechanically to correct it, okay? And then you need other things like the muscles to stabilize it and things like that as well. So what do the chiropractic adjustments do? They put the bone back into place. They'll relieve the pressure off the nerve. They'll end up relieving pain, but also restoring function, okay? And the biggest thing is that it restores your life. It gets you back to doing what you love to do. When you came in here, Monica, that first day that I saw you, the second day that I saw you, what was the quality of your life that day?
Yeah, I couldn't move. I couldn't even move my neck to the left or to the right that much.
Right. And how long did it take for you to
Like 2-3 visits.
it didn't take that long, right? What we need to do is get it corrected from the long-term perspective. But getting people to function well is one thing. Getting it to function well for a long time is a different thing. And so that's where we wanna get you to have this for life, right? It's the long-term correction of the issue, okay? Versus the short-term patch. Because you can do the short-term patch, but then it's kind of treating it like that pill for the ill. Every time it flares up, I'll just do this, I'll just do this. But then 8 years flies by and you went from a phase 1 to a phase 2, and then there's certain things that we can't go back from, okay? So that's what true chiropractic care is about, right? And so my purpose is to help you heal yourself, not just mine, other chiropractors as well, okay? I really do love my profession, and what we get to do is super fulfilling, seeing people get back to doing what they love to do. Like what we were talking about with Scott and some of our other patients, like that's what really does it for me. And so I should put Scott up here. So this is Connor. You may or may not see him in the office, just based on what time you come in, but Connor actually, so Connor, when he first came in, Connor had lower back pain. He's in sales and in technology. So he's working at a desk all day, but he was not able to golf. And so he loves to golf, he loves to snowboard, and he's working at a desk all day. And come to find out, Connor has scoliosis. And so he's got a big curve in his lower back. And so he was having so much strain and stress down there that he wasn't able to do the things that he loved to do, right? Connor now has been able to have many trips. He travels quite a bit, not only for work, but also for play. He's a really lucky guy. He goes to Florida, Pittsburgh, and he's golfing with his friends and with his family. He was just out in California for a wedding. He goes golfing every Monday. He goes golfing.
Yeah, right over here.
Right over here. And he's able to golf full 18 holes, no back pain. When he first came in, he'd golf 9, and he'd be hurt, right? And then same thing, being able to go snowboarding. He picked up skiing because his girlfriend's dad is a ski instructor. So not only is he snowboarding now, he's also skiing. He's pushing the limit. He's pushing himself to be able to do more and more and more. And then this other gentleman here is a guy named Paul. Paul came in a similar case to you, Monica, except for his lower back. Paul was a college lacrosse player, and after he played lacrosse, so he had a lot of collisions playing lacrosse and stuff like that, but he was actually in a motor vehicle accident. He was driving a truck and there was like lumber in the back of the truck. He got rear-ended, and the lumber in the back of the truck went through the back of the cab and jammed right in the back and actually fractured his spine. So he actually has a fracture in his lower back. And when he came in, he works as an accountant, so he was working during tax season, and he was pretty stressed because he likes to really mountain bike with his son, and he's got 2 grandbabies.
2 grandbabies and
with one
2 on the way.
2 on the way.
Two on
Yeah.
the way.
And so he wants to be there for his grandbabies, and be able to mountain bike with his son and hike with his son, do stuff like that. That's like what he loves to do. But he wasn't able to do that. And he came in here, pretty skeptical, I'm not gonna lie. Pretty skeptical. It was before me, yeah. But he believed and he trusted me, and we got him not only adjusted, but we got him on the spinal decompression table. And he is now able to do everything. He now says he's better than he ever was.
Yeah.
Literally better than he ever was. He only comes in
every other week, I think.
Or once a month or something like that. He's like really stretched out pretty good, and like he doesn't even get adjusted, honestly. He mostly gets spinal decompression for his condition. So based on what his condition is what we do for him. When he needs an adjustment, he gets adjusted, but for him, he needs to stretch that lower back because it's fractured. So it doesn't take a lot of stress for that to go out of place. So he needs more decompression. So different cases need different things. But he's able to get back to doing what he loves to do. And that's the big thing. And so he built a room for his
baby room.
A baby room. He built a baby room for his grandbaby that's on the way. Right? It's like just seeing someone be able to do that type of stuff. Like I can only imagine how fulfilled he was, you know? So this can apply for many different people, but also different like professions and stuff like that. My goal is to make sure that we also educate people on how to live a healthy lifestyle with longevity. So we also do different workshops like this, like we've done tonight, in different organizations as well, to help the people in your organization be able to live with less stress. That way they don't have these injuries, they can do more things, they can go walk houses without having to worry about going up and down the stairs. They can work at a desk and they can do their sales calls without being hunched over all the time, and then, you know, when they get out of work, they, you know, can go and walk their dog or whatever that looks like, you know? Just to make sure that they can live their healthiest life too. So if you know of anybody or any other organizations, please let me know, because my goal is to go out. We will take care of like lunch or breakfast, depending on when you guys do your meetings and stuff like that. We just gotta coordinate it. And so it's part of the outreach that we do, because chiropractors, in my mind, have not done a great job of educating people about chiropractic, which is why I do this new patient orientation about once a month. It's something that I feel we need to be doing more of as a profession. So we'd like to take care of that as well. And the truth is, I walk the walk. I get adjusted once a week. I have different stresses on my life. I've been adjusted for a long time. That's what I personally love to do. Did that go?
It went away.
Let's see. So,
Perfect timing.
Yeah,
Not perfect timing, but like.
So I try to walk the walk. Like my life really does revolve around Megan, who's my wife, and like we love to go hiking and camping and snowboarding and all of that type of stuff. And like this next weekend, we're going to Grand Teton National Park to go hiking and camping. Like that's what we do. Like my mom and my dad, they get adjusted by the chiropractor that I went to when I was 16 years old. Literally the same doctor. It's just one of those things like where it's a lifestyle, because I want to live my lifestyle as long as I possibly can. So I just want to share that I'm also just like you guys. Like I do the same exact thing to make sure that I can live my best life, essentially. So that is really all that I have for you guys. So I hope that you guys got some piece of valuable information that you can take with you and run with it. If nothing else, I hope you enjoyed dinner.
Thank you.
You're welcome. You're welcome. And I do want to share with you, if you guys know of anybody, actually Monica has already done this without even realizing it. Our goal is to help more people be able to live their healthiest life. So what we do is a friends and family referral program. What we like to do is anybody that you refer in, we like to do a complimentary consultation, examination, any necessary x-rays, and the report of findings. So basically the information gathering day, so you know what's going on, how to best correct it from a long-term perspective, and because that's part of our mission, we do that complimentary because you sent them in. The other thing I like to do is I like to create win-win-win situations for everybody. So I like to give people like an Amazon gift, a gift card on Amazon, and that's my way to say thank you for trusting me, not only with your health, but with your friends, your family, whoever that might be. So if you know of anybody, you'll see some of these cards. There's some right here. There's probably some on the way out or by the front desk. Feel free to grab some. If you know of anybody, just share them with them. And whatever that looks like, whatever the perfect time is, we'll be here for them. So
Awesome.
cool. Hope you guys enjoyed tonight.
Thank you.
Yeah, you're welcome. If you have any questions, please do let me know. Happy to answer, happy to take care of anything else that we can.